And I just want to do a little bit at the base of the neck, and you can hold him. That's good. There it goes. Sorry, boo-boo. Good boy. There it goes. Good. I have Kris here today, and this is his dog, Simba. We also have Angela here today, but she's off camera. And Simba is 9 years old, right?
Yes, he is.
And if you can't tell, Simba's a Yorkie. Beautiful face. You look so great, Simba. And Simba had some surgery when? Like a year ago? Or
2 years ago now.
Okay, and that was on the back left knee?
Correct, this knee here.
Okay. So what happens with a lot of the little dogs, if you are not familiar, but a lot of little dogs can be prone to getting hypermobile kneecaps. They call that subluxating patellas. Or hypermobile patellas, which is another word for kneecap. It happens to these little dogs quite a bit, and if it's chronically dislocating, there's a surgery that they can do. But since then, depending how he might have responded to the surgery, he still limps a little bit.
Yeah.
And at 9 years old, which is getting into the senior years of any dog, it's good to do a checkup. So today we're going to look for any pain spots, look for any imbalances, gently give Simba a little adjustment, and that's your goal, right?
Yes.
Okay, good. So let's get cracking. Simba's like, oh crap, what does that mean? What did you get me into? So now you're gonna go to your spots. We have angles to work off of. And actually I'm gonna have him, well, let's start this way.
Okay.
Where he's facing you. So I first like to ask for consent. Simba, could I work with you today?
Sure can, Doc.
See, I heard that. Did you guys hear that? All right. It almost sounded like Kris's voice. But, you know, being the son of Kris, he probably
Like father, like son.
has a similar tone to his voice. All right. So as long as it's okay, let's get started. And let's just check your little neck and bring your head down. So that head should be able to pull towards the sternum. The nose should be able to come all the way to the shoulder or the side of the body, and it does really well to the left. Let's check one more time to the right. A little tighter on that side. And then the head should point straight to the sky, and I'd like to see it come better than that, so that's a little stiff. So I found two ranges of motion. Right lateral flexion was about 90% where I'd like it to be, and I'm comparing it bilaterally, so when I take the nose to the left shoulder or scapula, it comes straight over really clean, especially the last 10%. So it's going, and it just claps against the left side. When I take the nose to the right side, it's flowing, and when I get to be about this far away, it goes and gets tight. Did you feel that? Did you feel that? So I'll show you one more time on the extension. I can't really get past that. It's locked. And I'd like to see the head come all the way up perpendicular. So let's do a sequence, okay? So Simba, I'm gonna first do your right atlas. No, I got some of it. There it goes. Sorry, boo-boo.
Good boy.
That was actually good. I got it, and it clicked.
Good boy.
You can let him go just for a second. We just won't let him fall. See if he might shake a little after that. He's running away from me is what he's doing. Okay, so then let's do the C5 on the right. There, and then we're going to do, pushing me away. Then we're going to do the one to bring the extension back.
Simba, baby.
So I'm going to bring your head up. There it goes. Now watch the difference. One sec. Let's put his legs down. There it goes all the way.
Oh, good boy.
Do you see the difference?
Yeah.
Good, and let's see if his head comes all the way to the shoulder. It does, no problem. So I cleared out the neck. I know he didn't love that, but he's gonna love that when next time we have a solar eclipse, he can see it. You'll have to wear special sunglasses so you don't hurt your eyes. This is a percussive instrument, it's very soft. And I just wanna do a little bit at the base of the neck. And you can hold him. That's good. Okay, so that part's done. So now we're gonna go down the back and check the rest of it. So he's gonna turn towards you.
Okay.
And we can adjust him right on you, so if you want to hold him, that's great. And so now I'm going to just come down the back, and dogs have 7 bones in their neck, and then 13 in their mid-back. We have 12 in the mid-back, they have 13. And we have 5 lumbars or lower back bones, and they have 7. So there's a different amount. Angela's phone just went off. Angela, come on. So here's a little tough spot. So this is the area where the thoracic or mid-back area where the rib cage ends and the lumbars begin, and it gets really tight on dogs, and dogs or horses tend to get arthritis in this area. And so we call this the thoracolumbar junction here. There it goes. Got it, okay. And that area is like right here, and that's a good spot to release on either a horse or a dog. And since you're a dog, we did the dog move on you. So now I'm coming down through the different lumbars, and now I'm at the top of the sacrum where L7, 7th lumbar, meets the top of the sacrum. I'm going to do that with the tip of my thumb. Got it. Now let's just check his back legs now. And you can hold him still. He could still be on you.
Okay.
Just don't let him jump through your arms. So here's the back right hip. And here's a little spot there. And then there. Let me check the nubby tail. There. Check the kneecap. This kneecap's in. Let me bring your leg back a little bit. Good. Bring it forward. Bring it into abduction. Got it. I'm going to just do it. You won't see this because it's on the other side, but thank you. Good. I think I got him really good. So his kneecaps are in on both sides right now, which is great. And his hips are in good. His rib cage feels perfect. Your neck feels so much better. And let me get one. There we go. Let's get him on the ground now on that black rubber mat. And then let's see if he shakes out.
There you go.
All right. What do you think, Simba? Are we friends again or not really? Hi. I know you're like, do I like him or do I hate him? Probably a little of both. But you're going to see he's going to have better range of motion. Sometimes as the dog gets older, you'll notice they almost have to eat on their belly. They can't stand and bring their head down to the bowl of water or food. And that's sad because it means their neck hurts, typically. And so we want to check both coming up with the neck and coming down with the neck. And I cleared, coming down was no problem, but coming up there was a lot of restriction. And you saw at the end we were able to bring his whole head past perpendicular, even looking back behind. So that's great range of motion. And the hips need a little bit of work, but it was more of the sacrum and the lower back. And I'm filling you in on this too, Simba, in case you're listening. So it's just good. You know, someone like Simba's age, if you're interested, you can come, you know, 4 times a year or twice a year or once a year, whatever makes sense.
Okay.
And also if you see any changes, like, you know, he's not moving well, or is he limping a lot now, or he comes up after a good run or zoomy, he's now favoring a leg, or he's not able to do something he was always able to do, that's an indicator that something's off. Or if you're touching them and they wince a little bit.
Okay.
I also made a video course that you could check out sometime called How to Massage Your Dog. I want to share a product that I'm really excited about, and in this case it's my product. I made this video course recently called How to Massage Your Dog. The website is called howtomassageyourdog.com, and it's still on sale if you check in with it, but it gives you a way to work on your dog from head to toe, whether it's a few minutes a day or outright full body sessions. It's good for that puppy. It's also good for your senior dog. It's a way that you can manage pain and help that dog not suffer as it goes through the different stages of life. I show everything in this video course, from hand techniques through full body massage, everything from a teacup dog to a Great Dane. It's all in one video course. Check it out. Let me know what you think. And there's even a 30-day money-back guarantee if you're not completely satisfied. howtomassageyourdog.com. Throughout the course, you get a little muscle anatomy, skeletal anatomy, how to use your thumbs, how can an everyday person work on their everyday dog. So it's not for professionals, it's for just people. And I made that course because I get a lot of people from leaving me comments from around the world going, I wish you could come to this country, or I wish you could come to that country. Well, now I'm getting emails saying, great, I'm able to work on my senior dog now, and they're moving a lot better. So that's something you could do if you never come back. Just, you know, start to massage into the legs and the butt and the thighs and the hamstrings, and you'll learn how just by watching these videos. And that's something you could do when you're with the dog anyway. You're on the couch anyway.
Yeah,
you're watching
yeah.
TV anyway, and you can do some technique other than the normal strokes that we always do. You'll have more tools in your toolbox of technique that you could apply. And especially if you find like the dog has, you know, tenderness around the hips or wincing when you touch the right back leg, well, you can rub in with your thumb really gently and find those tight spots and work them out. And so that's something people can do at home, which is really nice. And body work is always good, but dogs really respond to body work.
Okay.
Really respond. And that way you can save a lot of money with not having to chase down every ache and pain, bringing them to professionals and spending money for that.
Sure.
Okay? Thanks, everybody. Thanks for watching. No, I got some of it. There it goes. Sorry, boo-boo.
Good boy.
So I'm going to bring your head up. There it goes. Now watch the difference. There it goes all the way.
Oh, good boy.
Do you see the difference?
Yeah.